Now, the World Health Organization has set up a new body to develop a pandemic treaty. This comes after a World Health Assembly resolution that mandated the establishment of a legally binding instrument to protect the world from future pandemic threats. Former Health Department Director General Precious Matsoso will co-chair this new global entity, and it's known as the Intergovernmental Negotiating Body. She joins me now to talk about their work. Good afternoon, ma'am. Thank you very much for your time and welcome to eNCA. This is a huge task that you and your colleagues who are part of this Intergovernmental Negotiating Body of the WHO have been tasked. It's a huge challenge.
Good afternoon, Avukiden and listeners and viewers. Indeed, it's a huge task, a huge responsibility, and which is obviously going to require the whole of government, whole of society in every member state to respond, because we can only do this to make this a better place and make this a fairer world.
Yes, I understand it's a 6-person bureau with representatives from other continents, but you represent Africa. You've been chosen to represent the Africa region on this. Are you expected to bring all of Africa's concerns there? So you're going to be coordinating from various countries on our continent their input?
Yes, absolutely. In fact, since its inception, I've been in touch with the ambassadors of every single country in the continent. And as I speak, next week we'll be having a meeting of ambassadors who are based in New York, some that are based in Geneva, and others that are based in Addis Ababa.
Okay.
Meaning we're going to make this as broad as possible, as inclusive as possible, and ensure that we get as, broad input as possible.
Yeah, you're supposed to come up by August, I understand, with a draft pandemic preparedness treaty. Will it take into account concerns, for example, about vaccines? I mean, we saw the developed world hoarding vaccines, and many people were outcries, including our own president here in South Africa, about that discrimination, and lots of people saying there's so much injustice by the developed world against the developing world.
Well, just a correction. In August, we were supposed to come up with a working draft that will serve as a basis of negotiations, because this must be a negotiated agreement. We must still agree on whether it must be binding, but most member states had expressed interest in making sure that it's binding. We have to establish as to which part of the WHO constitution should we rely on in formulating this legal instrument. Some have said it should be a treaty, others said it should be a convention, some said it should just be a regulation, like we have international health regulations. So what we did as a bureau, the 6 of us, we came up with thematic areas that would use as a basis of consultation with the member states and other relevant stakeholders. Firstly, we identified equity as an important issue because we saw the scramble for supplies, gross inequities for vaccines, diagnostics, and other therapeutic agents. The second one was about governance. We've seen problems of governance, not just at a national level, but globally, within the international system. And thirdly, we also recognized that there was gross underfunding for preparedness. So we would like to have a sustainable financing model, both at a global and local level. And finally, we said there must also be initiatives that will ensure that the tools and systems are in place so that we have early warning systems, but also there's also research and development for new technologies in future and systems. We saw the plethora of information systems and digital systems that were used. Some, were good, others not so good.
Yeah, thanks for that comprehensive summary of what you're working around, those themes. But just a quick question here. Do we need a treaty? Is it because the vaccine inequality, for example, and the lack of preparedness has shown us the way that we're not prepared when we do have international health regulations?
Well, this has been a debate and a discussion. And coincidentally, I have been a member of the independent panel on pandemic preparedness and response. And in the evaluation that we did, because we started the evaluation last year, and the outcome of that was that firstly, the world was not prepared. And it was not prepared even with the availability of the international health regulations. So our view has been that the international health regulations by themselves are not adequate, firstly. And secondly, most member states, even those that have capacity, those that have resources, have shown that they were still not prepared. So we needed something to support the implementation of the international health regulations. Like, for instance, vaccine inequities are not addressed in the international health regulations. Governance is not addressed in the international health regulations. There are some aspects of the international health regulations that are adequate, that are still good, and that should be implemented. But we also need another overarching instrument that will ensure that the instrument is not just confined to the health sector only. As you noticed, this pandemic has affected everyone everywhere. And it is for that reason that you need a much more overarching instrument.
Okay. Finally, I can't end this interview without making this point, because South Africa has produced magnificent and highly regarded scientists. And the fact that you, as a former DG of health in this country, as a health expert, you're part of this, and as a co-chair, means quite a lot. I'm sure it's a moment for us to be proud of. I know it comes with a huge responsibility. Are you foreseeing a situation where, because of your trajectory and of who you are, that you're going to be you asked to push through a South African perspective, or you're going to have to respect a continental perspective?
Well, I'm happy you've asked this question because as bureau members, we have to be independent of views. When we receive inputs from different member states, including South Africa and Africa, we have to view them in an objective manner, and our process has to be transparent and inclusive. So we cannot show preference from one group over the other. So there must be some form of balance, but recognizing that there are some regions that have been disproportionately affected by this COVID pandemic, and that the inequities have been quite significant in our region. So those aspects will take into account as we consider our recommendations and in our move towards development of this instrument.
Okay, a multilateral body like the World Health Organization is a big elephant. It's a big ship, takes long to turn and move. By when do you think, after your working draft of this pandemic treaty is presented in August, by when do you expect and hope that the World Health Assembly will discuss it and approve it? Because pandemics wait for no one. We don't know when is the next one.
Oh, absolutely. I actually agree with you. They don't wait for us. So we must be ready. In that respect, in fact, the actual work begins after August, because when we have that working draft, that's when the negotiations start. And I must say, I've gone through this process before, because you may be aware that I was previously, before I joined the Department of Health, I was a director at the World Health Organization of Public Health Innovation and Intellectual Property. And that process of negotiations requires skill, requires agility. So we're going to have to be agile, skillful, but ensure that we can meet our target. So we will work skillfully with member states and direct them in a manner that they can give us a product. So our expectation is that next year we'll have the first draft, and hopefully if it's ready by next day, it should be adopted. Failing which, it means it will go on to the next World Assembly of 2024.
Okay, we hope not. We hope not. Good luck with your work. And of course, you've got the skills, you've got the experience, you've got the respect. You're flying South Africa's flag high, and we are proud of that. And we will touch base with you, Ms. Matsoso, later on in the year to see how it's going. That's Precious Matsoso, who's been chosen to lead or to co-chair the intergovernmental negotiating body of the World Health Organization, tasked with drawing up a draft pandemic preparedness treaty for the whole world.